We have realized that PCOS women have high body mass index, that is, they are obese. They tend to come from families which have diabetes. They themselves may be prone to diabetes in their later lives. They are hirsute, meaning they have excess of body hair. They have male pattern hair distribution also, so there is some hair loss in the scalp. They could also have a change of voice. The male pattern of voice may come in. They are sometimes or usually very good looking, fair, and there are other common things associated with them, like there could be a dark brownish patch on the neck or in the armpits or below the breast. We call this the acanthosis. So these are the points which may indicate that a lady may be suffering from PCOS. She usually does not have regular menses. On checking her blood levels, we find out that the LH levels are very high. So now we are clear that PCOS has a few problems. First of all, the lady does not produce eggs, even though she has lots and lots of eggs. The reason why this happens is not very clear, but essentially because the FSH hormone that is present in the body is not able to mature that egg or select that egg properly. How do we treat somebody suffering from polycystic ovarian syndrome? Quite obviously, we're trying to correct her underlying problem. So if somebody has a high body mass index, that person needs to lose weight. We ask her to go on a carbohydrate restricted diet, do more walking, jogging, etc., so that she can lose weight, and that definitely improves her body mass index. If somebody has a lot of body hair, we can give her oral contraceptive pills which contain anti-testosterone molecule, which helps her to lower body hair and other problems, acne, etc. With all these efforts, there can be an improvement by lowering the LH levels. But the most important tool we have to understand is only when we can increase the FSH hormones by giving medications from outside. Now these medications could be oral medications like clomiphene citrate, or could be injections of FSH. Usually when the tablets do not work, then we give them injections from FSH. These injections help us to increase the FSH levels maybe beyond what the LH levels are, and thus help us to select the right follicle. Most women who have polycystic ovarian syndrome tend to get pregnant with the help of FSH injections and or clomiphene tablets. But there are some problems with some women. Sometimes, as because we don't know the right dose of FSH injection, we might give excess amounts of FSH injections, which is when she produces lot of eggs and she goes into a condition known as ovarian hyperstimulation syndrome, which is not good for her. She needs to be carefully monitored by a specialist then. At other times, even after giving her FSH injections, she fails to respond because maybe the dose given to her is not optimum enough. In those cases, we have to go for a procedure which is known as laparoscopic ovarian drilling, where we put drills into the ovarian tissue to drill holes into the tissue, which may help us to lower the LH levels. Rarely, in some polycystic ovarian syndrome, we've realized that there is a genetic problem which does not allow the hormone given from outside to work on her properly. In these women, there has to be a genetic modification or genetic engineering done, which is not possible as of now. So for now, what we need to do for them is take somebody else's eggs and then get her pregnant, which is not a very happy condition, but then that is the only alternative left for a very few of these polycystic ovarian syndrome women.